My name is Thomas Boyd, so I'm the Senior Manager of Business Development here at the Nicholson Center. And what the Nicholson Center is, we are a 54,000 square foot clinical education and training facility. We train physicians, researchers, and clinical professionals from all over the world come to learn about all the latest and greatest minimally invasive techniques and robotic surgeries. We can actually house up to 50 surgical stations here at the Nicholson Center. In the Skills Lab 1, 2, and 3, we can house up to 25. So, and by what I mean by a surgical station, we have an OR bed as well as a laparoscopic tower with a monitor. But we also work with basically every specialty you can imagine here. So, urology, gynecology, general surgery, bariatrics, cardiovascular, cardiac. So we really touch basically surgeons from all specialties from all over the world come to train here at the Nicholson Center.
Well, I think the International Prostate Cancer Foundation is really a career in the making. I've been practicing urology and taking care of prostate cancer patients for over 12 years now, and it really became something that was important to many of my patients and many of my colleagues, and so it really came out of concern from patients about care and making sure they got everything they needed for their life and for their prostate cancer diagnosis, and also concern from physicians. International Prostate Cancer Foundation stands for a lot of things, but I think really it stands for supporting men.
My name is Haidar Mohammed Abdul Mohsen. I'm originally from Iraq. I finished my medical school there, and then I was doing my training in Doha, Qatar, and there where I have met Dr. Patel when he came to do one of the first robotic cases in that country. At that time, I was in my final stages of my training, and my aim was to pursue further training in minimally invasive urology, and I found this as a golden opportunity.
Eu me chamo Kenneth Palmer. Sou urologista, especialista em cirurgia robótica. Sou associado do Dr. Patel. Levo com ele uns 7 anos fazendo cirurgia robótica da próstata. Viajamos fazendo cirurgia robótica. Faz duas semanas nós estivemos em Lisboa. Fizemos cirurgia robótica, cirurgia robótica no Hospital da Luz. A semana passada estivemos em Rio e em São Paulo. Sempre, todos os meses, estamos em uma cidade, um país diferente.
It's a pretty devastating, diagnosis, I guess, when somebody says you have cancer,
I can't quite explain how I felt. I knew when the doctor walked into the room, just by his demeanor, that this was not going to be good news. And once he said to me, unfortunately, you have, and I think that's the last thing I heard.
So I started investigating different hospitals, different doctors. I ended up with Dr. Patel because I have a friend which is a doctor in Miami, had surgery with him 4 years ago.
Well, Dr. Patel was recommended as one of the leaders in the industry, and certainly understanding that, could not proceed without interviewing what had been described as me as the rock star of prostate surgery, and that was meant as a compliment.
And it was my urologist that basically said, in his mind I had 2 options. One of them was radiation and the other one was surgery. And he said there are a couple types of surgery. There's the kind of the old-fashioned where they go in and they cut it out, and you kind of let the chips fall where they may. And he said, and then there's robotic. And he said, I'm not going to tell you any kind of treatment. I want you to go visit these different doctors. So we visited a radiation oncologist, and we visited Dr. Patel as well. Spent a good amount of time with each one and had lots of questions. And in the end, we kind of voted, between both of us, we voted that the surgery seemed to probably the best.
So they programmed everything for November. I had my surgery, and here I am. I'm feeling great. Everything has worked out very, very nicely.
Bem, o Dr. Patel é o rei da robótica no mundo. Ele é o número 1 do mundo, é um dos homens mais conhecidos, um dos médicos mais conhecidos do mundo em se tratando de robótica. Eu vou falar com ele agora, porque afinal ele é o pai desse evento. Dr. Patel, congratulations for this event. It's just beginning, right?
Muito obrigado. Yes, it's just beginning. This is our yearly event, raising awareness for prostate cancer and men's health. And so we have people from all over the world. We've gathered more than 400 people, and we're having an event tonight to celebrate survival from prostate cancer and also to promote awareness so people know that they should be checked for it.
Yeah. What's the most important thing of this event?
I think the most important thing is the people. We have men coming from all over the world who've had the disease. It has a connection. They're there with their wives, their significant others, and many are here with their children and their brothers. And the reason is prostate cancer is very hereditary. It's genetic. It's passed down through the generations. And so we're educating the men who've already had it, but we're also educating the next generation that may get it about what to do to find it early.
O Dr. Kenneth Palmer trabalha com o Dr. Patel há 7 anos. Dr. Palmer, tell me, how is this experience of working with Dr. Patel for 7 years and robotics?
Well, it's been quite a ride. It's been a wonderful experience in the sense that I started with VIP as a fellow. He trained me in robotic surgery. I'm originally from Venezuela, and Venezuela was the first country in Latin America to buy a robot.
First country?
First country in Latin America back in 2006. So I was in a fellowship at the time at the institution where that robot was bought. They trained with Dr. Patel at Ohio State, and that was my link, that when I finished that fellowship, I started a new fellowship in January 2007 at Ohio State University.
How is it to be the king of the robotics in the world? You're very competent, you're number 1 in the world, you're doing a great job, everyone is talking about you.
Well, you know, when you see, like today, all these men with prostate cancer, is very humbling because you can only help a certain amount of them. So we're one of the busiest places in the world for this, but there's more. You know, we want to help people all over the world. We want to have the cure, develop the vaccine so that maybe one day we don't have to do surgery on these patients. That would be the ultimate goal, actually. And that's why it's very interesting that a surgeon has a foundation that is promoting finding the cure.
Está acontecendo nos eventos mais importantes com relação à prevenção do câncer de próstata aqui nos Estados Unidos. Esse evento, ele é uma ideia do Dr. Vipul Patel, que é a maior autoridade do mundo em câncer de próstata. E à noite vai ter um jantar, que é um jantar que chamam aqui de charity, onde as pessoas vão contribuir de alguma forma. Tem leilões, tem uma série de coisas que as pessoas contribuem para essa fundação do Dr. Vipul Patel.